We are talking to Deborah Schendiman. She is the supervisor for the SeniorCare Caregiver Support Program, and Susan Doughty, Caregiver Support Specialist. Good afternoon, ladies.
Good afternoon. Thank you for having us.
Deborah, can you start by telling us about the SeniorCare Caregiver Program?
Yes, excellent question. Thank you. The National Family Caregiver Support Program was established in 2000 as part of the Older Americans Act, and we've been affiliated with them from the beginning. It was to assist caregivers in a variety of ways, and there were several objectives. First, it was to provide information to caregivers on local resources and services, and then also to help them with assistance in gaining access to those services. So we don't just give them a bunch of information, we try to help them pursue that information in a way that's specifically helpful to them. And then another objective is individual counseling. That is for maybe assessing the options that are available to them, help them with problem solving, help them with stress and de-stress, and also to make referrals to therapists if that's needed. There is, alongside that, the opportunity for giving training and education to caregivers. So we have two programs, the Savvy program for caregivers and Powerful Tools. We offer those 6-week classes several times a year, and they're designed to provide a toolkit to caregivers so that they have the resources personally to address difficult behaviors, decision-making, problem-solving, and to basically build their confidence and their competence in their caregiving role. We also like to provide opportunities for respite, some of those through SeniorCare's home care program if they qualify, and we can give them direction on that, or through private pay resources. And then, of course, occasionally what we call mini respites, and Susan might expound on that later on in the program if we ask that question, and that helps people on a daily basis to relieve their stress. So those are the sort of 4 or 5 major objectives of the program that are required of us. And then, of course, we don't mind going on a rabbit trail now and again to see if we can help people with whatever they might come up with.
And Susan, do you want to describe who caregivers are?
Well,
I think,
Deb, would you like to expand on that?
I think I will, as I had recently addressed some caregivers who did not necessarily meet the criterion, so that is important. It's for any individual who is caring for an adult 60 and over, or any caregiver who is caring for an adult of any age who has an Alzheimer's diagnosis. And then if you're 55 or older, caring for a young person who's under the age of 18, or if you're caring for a disabled person between the ages of 18 and 59. Now, if someone calls and they don't quite meet that criteria, we're happy to help direct them to the various agencies and resources that might be helpful to them, and to provide some sort of instant support depending on what they might need. So we're not stingy in what we want to offer to those who might not strictly fit the criteria for the program.
And Corey, do you want to take this question?
Well, I just want to know, initially, do we want to talk about how people can access support? So we can show that graphic for you while you talk about that. Susan, do you want to take that?
Sure. So the main number at SeniorCare, which I believe is you have up there, is a resource center, and you can just call that number and say, I'd like to talk to someone about caregiver support, and we'll discuss what ways it can help them. Everybody has a custom tailored plan that fits their comfort level, and we just connect them to whatever resources would work well in their particular situation. And there's individual counseling, one-on-one. I do one-on-one counseling, and we also have several support groups. And during this situation, we have a call-in line that we talk every Tuesday morning. So the individuals from the groups, or they don't have to be in a group to call in. Anyone can call in and listen. So we have, it was a monthly meeting, but now people feel they're more comfortable having more contact. So it's a weekly call-in.
So we have had a number of support groups in the past. We had 3 recently face-to-face, Wenham, Gloucester, and Beverly. And Susan is correct in saying that, of course, we can't meet in that way now. but a number of those folks have hopped on that conference line, and we hope to have a Zoom alternative if we can find out how comfortable people might be or technical savvy to join us on Zoom, which we feel would be very productive.
So it seems as if this program must be severely disrupted, and the lives of these people must be severely disrupted by COVID. Do you want to talk about that?
Well, of course, people are more comfortable when they meet you and they can sit with you. And just as the counselor, when you can see someone, you can see who in the group might be a little uncomfortable with specific topics. So it is more challenging. And of course, when we're on the phone, nobody knows who's going to start talking, first. Those, that has to be kind of sorted out or mediated. But overall, it's great for everybody to just connect. It's really helpful, and it does relieve stress. We've actually begun doing relaxation breathing and visualization, things like that, that have really helped reduce the stress. And given the situation, people are taking more steps to take care of themselves that they might not have done in the past because it's more intense. So now the need is stronger. So they are looking at a lot of these things, the meditation, the relaxation, that sort of thing. So they are adapting, for the best that they can. I mean, some people have those care recipients that went to adult day health every day so they could work. Those are really difficult situations. So that's why we're available more often in the group, individually. My hours have increased because people can't wait to talk once a month because they don't have all the other resources of someone, a neighbor or a friend coming in the home. We do offer services in the home, but a lot of the elders are timid about that. They don't want anyone to come in. They feel the anxiety is too much for them.
And we spoke to a group that was going around to homes and dropping off care packages for activities for certain people, right? Who were not able to make it to their adult daycare or an organization like that. Are there any other resources like that to help caregivers who had normally had their, their family member,
Absolutely.
Yeah.
Absolutely. There are lots of resources. We couldn't even list them. They're listed on the SeniorCare website. There are so many heartwarming stories about people. What do you need? I'll drop it off. Even strangers, but all kinds of groups are doing exactly that. No one should go without or worry about having food or other types of things. You just call, and councils on aging are doing it. SeniorCare is helping out. I couldn't, the churches, I couldn't even list all the agencies that are helping. They're doing a great job. These are volunteers, and it's just hard.
I would add to that we are affiliated with our nutrition department, with the councils on aging, with the food pantries, and various other groups, RSVP through SeniorCare. And we actually sent out a packet to all our caregivers, most recent caregivers, outlining for them the various resources that are available so that they would have hard copy and could refer to those or call us to talk more about them so that they could have some of those immediate needs met. So that's been, we've found a great deal of cooperation among all these various agencies, and resources been very helpful to us as we respond to the caregiver needs.
And I'm sure, you're addressing anxiety, as you said, in terms of meditation and these Zoom calls, but how about real mental health issues? Because this has got to be just such a trying time. Do you have access to therapists or that you can offer that sort of support?
Absolutely. Even before COVID, one of the goals would be to connect individuals with therapists, and SeniorCare has a list of some therapists that have been tried and true for years. And sometimes, depending on the situation, we can help to pay for that, but it's typically covered by insurance. But that's always one of my goals. Caregiver counseling is important, and it has a specific function, but having an individual therapist to talk to every week just focused on you is really helpful. So that's always one of the goals. And people are getting more comfortable with that. Some aren't comfortable with a therapist, or they're okay to talk to the group or to me, but that is changing, because especially in the groups and communication amongst caregivers, they'll say, oh yeah, I didn't want to do that at first. I don't want to tell people but it was so helpful. I don't have to take my medication anymore, things like that. So it is changing, and it is, and caregivers are almost synonymous with anxiety and depression anyway, even if you weren't prone to that previously. So this is one thing we look at right away and hope that we can encourage people to be comfortable with considering that.
Mm-hmm. And we are able in some instances to help with co-pays for those therapy sessions, which we hope make it available to more people, I think. And most of the therapists are doing telephonic interviews or sessions now, and so they haven't slowed down in their work. They just don't visit the individual, and it seems to be working for them.
Mm-hmm. And last question along this line, I'm sure employment, we sort of referred to that earlier, is maybe compromised for some of these caregivers, whether it's because they have their person at home or because their job is, has been, halted. Are you supporting, what are you doing for that sort of situation?
So there are a couple, depending on the situation, of course, but that's a difficulty for all caregivers that are employed. So we do come up with a plan of action to either adult day health or workers in the home or informal supports that they might not have thought to ask for help. Mm-hmm. There are all kinds of options. I mean, the list does go on and on, but we look at trying to keep them employed when they want to be. There are also programs, depending on the qualifiers, with the caregivers and care recipients, that will pay a caregiver to stay home and care for their loved one. So there are so many options. That's where options counseling comes in. Options counseling is the other half to caregiver support counseling, which is what are all the resources in the area, what does SeniorCare have for resources, what would work well that you're comfortable with. So.
Yes. We also try to steer them to unemployment, which if they can get onto that, certainly gives them some relief. Some people have been reluctant to do that because they think it's a handout, but we try to convince them that it's there for them and they basically really need to follow through. So we give them those resources and referrals so that it can sustain them during this time, many of them losing that livelihood, which is so much needed.
Right. Corey, do you have any last thoughts?
Well, we were talking to Scott Trenti earlier and throughout the entire pandemic, and he's given us such a wealth of information and touched upon so many facets of senior care and how you're helping people out there. And we've sort of made a call for volunteer efforts to help senior care along as well. But is there any information for folks to access these resources that you've spoken about today?
They just have to call the SeniorCare number, which I think you've put up. Yeah. And we can connect them. We have so many programs through SeniorCare, as well as any other programs outside of the agency. We're like a clearinghouse for resources. One other thing I would like to bring up that I feel is significant for caregivers is the grieving process. Caregivers are grieving not after they lose the person, their care recipient. They're grieving throughout the process. So I like to encourage them to be gentle with themselves because they tend to, I should do this, I shouldn't do that. They tend to be hard on themselves. They're grieving a lifestyle. They're grieving a change in relationship with the other person they're caring for. They're in a grieving process, and oftentimes some people don't understand. It's not when someone passes that they need all the support and the understanding. Condolences. It's throughout the process. So I encourage caregivers to be gentle with themselves and not put more pressure than they already have. But this does work. It's great to see when caregivers take a deep breath and say, oh, I'm normal to feel like this. Oh, I can do something. You mean I have choices? Oh, I have some control over what's going on, as far as taking care of themselves. Or choosing, we give them lots of tools and they choose which ones work for them, they're comfortable with.
I imagine control is a huge issue. That must feel like as if they just have, it was hard to start with, but then in this crisis, they must feel really as if they have lost all control. So
it definitely, and it does change. It changes from morning till afternoon. I'm having a good morning. Oh, this afternoon was difficult. The important thing is to ask for help. Caregiver Support is a free program. There's no long interview or signing papers, and caregivers define it. Do you need to talk twice in 1 week? Do you need to talk once every other month? Things get stabilized initially, and oftentimes caregivers will need to come back in when things change. But it's a no stress program. I love that part of it, but it's just great to see caregivers, so relieved. So it's a very rewarding job to do, and I just feel blessed to be able to do that.
Well, thank you so much. Any other last words, Deborah, from you about the SeniorCare Caregiver Support Program?
We just encourage people to call and explore with us how we might be able to help them so that we can flesh out some of these opportunities. And like I said before, we'll go down any rabbit trail. We'll provide any help. We're not stingy. It doesn't have to necessarily fit like a glove. And we're just out there to support as best we can. So just encourage them to call the number. And if we can't service them, we know that there's someone who can. We're willing to make that referral.
Wonderful. Well, I know we're going to have the number up there prominently, so we encourage people to do that. And thank you for spending time with us and helping get this information out to the community. Really important.
Thank you.
Thank you.
It's been our privilege.
Be well.
Bye. Be well.